So, Dr. Jaffe, can you explain the possible uses of the LRA by ELISA Act Silicone Sensitivity Panel? Why would one consider getting this panel done? What are the various reasons?
Yes, there are only a few reasons to focus on the silicone sensitivity panel. One is you might be having an implant, orthopedic or breast or other, including dental or plastic surgery, where silicone will be part of the implant. And I think everyone should be tested ahead of time to make sure they're not hypersensitive to silicone, because you'd be surprised that people can be and are measurably reactive, even though they had not previously had an implant. So the first is to see if you're tolerant to silicone. The second is, if you've had an implant, does your body show continuing delayed hypersensitivity, in essence, to that foreign body? The only way to know is to look at the T cells using the LRA by ELISA Act for silicone. And if you are hypersensitive to silicone, we suggest you should look at other common foods and chemicals so that you can restore tolerance systemically, in addition to helping make the decision of whether an implant should stay or go. Almost everyone today agrees that silicone breast implants accumulate white cells on the surface that recognize it as foreign. The question is different. The question is, does that matter? And us immunologists, we're confident it does. Women who have had those kinds of implants and have them removed often report that their quality of life substantially and significantly improves. Now, when you have a breast implant removed, you can just remove it, or you could use one of the newer generation so-called saline implants, different texture, but always coated with silicone. So the notion that you had saline inside the implant is only relevant if there's something going to leak from the inside to the outside of the implant, which unfortunately does happen. And that is a problem. So if you have a leaky implant, you should have it removed. And in my opinion, you should have it removed and recover before you decide whether to have any other kind of physical object placed there. I hope that was clear. I think you need to recover from the consequences of silicone sensitivity before you're going to be a good candidate for tissue repair of anything else that needs or wants to be done. So it's a much more interesting, complicated question than most people appreciate. It's worth testing before. It's worth testing if you have an implant. It's worth testing if you've had it removed to see if you're now tolerant or not. And it is not just about breast implants, because silicones are used in lots of places, not the least of which often are cookware that's nonstick. But when you use utensils in that nonstick cookware, some of the silicone substances get into you, into the food and into the person. Not recommended. Not recommended. So there are lots of ways to become silicone sensitive without knowing it. That's why the test is developed. Yes, we can help people understand the results and what next to do in order to improve immune defense and repair, neurohormonal balance, and quality of life.